Hemophilia and von Willebrand's disease are bleeding disorders that are the consequence of either deficient or defective coagulation factors that are key components in how the human body generates a blood clot to stop a bleeding event. Our program is a specialty clinic where we have the expertise to manage and diagnose bleeding disorders, to minimize the impact it has on patients' day-to-day lives, make diagnoses in patients who present with the question of possible bleeding disorders. We will take a detailed history, especially if it's an established diagnosis. We'll collect a lot of laboratory data. We'll formulate a treatment plan. Typically, if it's a new patient, we'll do a baseline assessment of joint function. They'll be visited by our social worker to make sure that aspect of their care is fully tended to. In the hemophilias, the most serious complication is bleeding into the joints, and this can result in what we call a hemarthrosis, a collection of blood in the joints, and there's an inflammatory reaction to that can damage the joint, and this is a major lifelong challenge in patients with particularly severe hemophilia. In the von Willebrand diseases, it tends to be soft tissue bleeding and other complications like abnormal menstrual bleeding in women. The patient will meet with the hematologist, an advanced practitioner, typically a social worker, and a physical therapist, which is particularly important in our hemophilia population that are affected by joint pathology. That's really the goal of our program, is to minimize the impact of the disorder and allow them to live a full and active lifestyle. That really reflects a change in hemophilia care over recent decades, from treating bleeding to really preventing bleeding and allowing as full a function as possible. We have a full range of other specialists in our referral network that are comfortable working with patients with bleeding disorders, and collaboration with other specialists is a key service that we provide, particularly when surgical services are required and we need to do our best to minimize the bleeding risk associated with those type of procedures. Our center has achieved federal designation as a recognized hemophilia treatment center. This should give patients confidence that we've met a critical standard in terms of multidisciplinary care and in-house expertise. It also affords us networking with hemophilia experts throughout the country, and really it provides our patients with assurance that they're getting world-class hemophilia care.